As I said earlier, the more topics discussed, the higher the recidivism rates, right? So you're trying to cram in everything in that, that session, right? So if I talk to you about 12 things, what are you likely to remember? Maybe the last thing, maybe, right? And if all I'm doing is talking, you're probably not going to remember any of it anyhow, right? Relationship quality in mandated treatment involves caring, fairness, trust, and authoritative style, not authoritarian style. Remember, these are coerced relationships. Right? These kids aren't here because they want to be here. This isn't like if you decide you want to go to some self-help program, you want to improve yourself. And that's not the same thing. The motivation there is intrinsic. For them, it's extrinsic. Somebody's forcing them to go to court. All right? So the relationship's important. All right? Trotter has underscored the importance of role clarification and the use of problem-solving skills. So making sure the youth understands what your role is, what their role is, and how we're going to work on specific problem areas. Now, Moana has been collecting data in Canada. They call it something different. They had a 12% higher retention rate. So trained officers were getting more compliance out of the offenders, and they've seen a reduction in recidivism. In their work, we're starting to see recidivisms coming down with the officers. As I said, we're still collecting data in our studies, but we'll be replicating all that soon. We got the principles: risk, need, responsivity. All right. So the risk principle we already went through: assess and identify higher risk, target higher risk, and avoid including lower risk and higher end programs, because it may increase their failure rates. We went through that this morning. Okay? Risk principle, ethics, you focus on higher risk. This is not designed for lower risk kids. Okay? You increase the dosage of treatment, because you're going to have, by the way, when I talk longer sessions, good ethics sessions about 20 minutes. All right? We're not talking about 3 hours. We're talking about 20 minutes. So it's not, by the way, the average right now without ethics that we found in Ohio was 6 minutes. Okay? And you know what, and what some people said, I didn't know what to talk to them about after 6 minutes. The need principle, these are criminogenic needs, right? Attitudes, fears, we went through them all. The main focus with ethics is going to be on criminogenic needs, particularly the thought behavior link. You want to keep stressing with that youth how their thinking is affecting their behavior. What were you thinking before you did that? All right? Let's work through it, all right? So that they start to see that connection. All right? Responsivity, of course, says remove barriers to treatment, match the style and mode of service to offenders. All right? General responsivity says use COG, focus on current, action-oriented, and so forth. In other words, the treatment principle. Treatment principle says that these general social learning, cognitive behavioral approaches are the most effective, but we also have to remove barriers that may exist for that youth to learn what we need. Right? There's lots of barriers. It can be lots of barriers. It can be intelligence, it can be maturity, it can be mental health. Right? So there's lots of things that can get in the way. Ethics allows you to do that. It's very active. You're going to require the kid to do something about their problems, not just talk about them. Okay? You're going to give them homework with this model. Okay? And it's in vivo. It's in a natural setting. We know we can get effects from institutional and residential treatment. We know we can. We see it in studies. But the effects are not as strong as when a youth is in their natural environment. And let me say this, it's a hell of a lot easier to do treatment in a secure setting. It really is. You want to get the dosage, it's easy. Right? They got them there for a year. That's not hard to get 200 hours out of them, right? You can work with that youth, practice. They all show up for group, right? I mean, you don't have the same barriers that you have. You have different barriers, but not the same. The problem with the institutional or residential settings often is They can't really apply what they're learning in their real risky situation. Right? Because you tell them to go to school. You're getting up in the morning, they're going to school, right? You tell them when to go recreate. In the community, they make those decisions. And so, if we can teach them the skills and have them apply them and learn them and practice them in their natural settings, we do see stronger effects. It's present focus. Past experience are interesting insofar as they are maintaining conditions of the current behavior. But for the most part, we want the officers or the caseworkers to focus on current, present behaviors and conditions. Okay? It's based on learning. Problem behaviors are developed through learning. Old behaviors can be replaced by new behaviors through learning experiences. Mainly what? Repeating it, practicing it, and reinforcing. Right? What do I always say? Practice, practice, practice. It's how we learn new skills. Right? And what we really like about this model is you can individualize it. Right? All right, think about it. We have assessments, we have curriculum. Okay? Every program I go to, what's the first thing I say? You need to find a curriculum. Here's something to consider. Why? Because it brings structure to the program. All right? So instead of, you got 5 facilitators, you know what the hell they're doing. Now you got a curriculum, they're doing lesson 1, and so forth. But here's the problem with that, is it's not as individualized. All right? Even with a small group, the kid only gets so much time to work with you and practice, right, one-on-one on their behaviors, all in the book. But what I like about ethics is it is truly individualized. When the officer and staff meet with that youth, they're not taking something out of a book. They're taking that youth's problem, behavior, and working on it. So in that way, just think about it. I mean, we can both, I can be a high-risk substance abuser. You could be a high-risk substance abuser for many different reasons. All right? You use it because, you've been abused and neglected, and I use because how I like to kick. I like my friends are used. So very different reasons we can be substance abuse, right? And sometimes groups don't allow us often to get into those individual reasons. We like to teach it this way. You go from simple to complex, easier to harder, and less threatening to more threatening. So you start out with the easy stuff. Right? Start out with the stuff that's not going to really push the buttons. And then over time it gets tougher. And this is example. After conquering the Riddler, Batman moved on to Secudo. Alright? So it goes easy to harder. Simple, complex. You got it. Alright? And of course, we use all these techniques. Reinforcement, modeling and role play, response costs, contingency contracts, thinking reports. They're all part of so it's very cognitive. Those are cognitive techniques. So the officer is going to reinforce the youth, all right? He's going to say, you came on time. That's great. That really helps me out because we get backed up around here, all right? He's going to work on modeling, all right? I'm going to show you, let's practice it. You're going to see that in the tape where the officer actually practices it with the client, all right? Response cost. What's going to happen if you continue to use? Or you continue to skip school? They have to understand the short-term, the long-term consequences. Contingency contract, that's what I did with Al, right? I made an agreement with her. I made it simple. 2 things. And of course, thinking reports. Right? That's part of cognitive behavior. You want them to tie that thinking to their behavior. Right? It's brief. It's a short intervention. Right? It's a short intervention. We think we can make it short because of the homework and the self-management. We're teaching them to manage their behavior. We're not doing it externally. We're trying to get them to do it internally. And then, of course, time may fluctuate. But we also found time fluctuates now. Sometimes you meet with a kid for 5 minutes. Sometimes you spend an hour and a half with a kid. All right? So it really does vary. This way, we put more structure on it. It tends to be more standardized, but sometimes if there's a crisis, you deal with the crisis, right? So a little bit different. Why do we do these things? These are